Assalamu alaikum my dear friends, I am Dr. Isha Fatma. In this video we will discuss about the medical allied and surgical allied rotations of Jinnah Hospital. If you are new to my channel, please like, share and subscribe. Thank you. So let's start our discussion with surgical allied rotations. So let's start our discussion with plastic surgery. It is attached to burn unit of Jinnah Hospital Lahore. Total number of house officers is 10, out of which 5 are private. Overall experience of seniors was moderate to a little bit toxic. Clerical work is much. In technical skills, you get to learn about intralesional steroid injections and burn wound dressing. As plastic surgery is a supra specialty, so there is not much clinical benefit for house officers, but some seniors are really nice and they love to teach you. So, overall, it is a light rotation and enjoyable and recommended for those who want to prepare for exams. Next rotation is pediatric surgery. Total number of house officers is 6, out of which 3 are government. Environment is very supportive, enjoyable, and less hectic. Overall experience of seniors was moderate. Clerical work is also moderate. In technical skills, you get to learn about dressing, catheterization, and circumcision. Being a super specialty field, you get less clinical learning. So basically, less hectic rotation and recommended if you want to study for exams. Next rotation of discussion is orthopedics. Ortho is considered one of the best surgical allied rotations for boys. There are two ortho units in Jinnah Hospital, and both of them, Ortho 1 and Ortho 2, have good reviews. These rotations have friendly environment, supportive seniors, and relaxed calls. Ortho is recommended for you if you want to learn and relax side by side. Now we discuss about ENT1 rotation. More or less, they accommodate 5 house officers, out of which 3 are government and 2 private. It is very supportive and enjoyable rotation and also not much hectic. Totally wholesome experience by seniors. Clerical work is moderate. In minor OT, you learn technical skills such as foreign body removal, wax removal by suction draining, tracheostomy tube care, and doing ENT endoscopy. Clinically, you get to learn all sort of OPD cases related to ENT. And seniors reviews were like, बहुत अच्छे से OPD आ जाती है. Choose ENT1 at start of your house job rotation because of more number of house officers. But in the end, house officers number is very less, which becomes a bit hectic. Now comes the ENT2 unit. It has more number of house officers, so less hectic call schedule as compared to ENT1. ENT2 experience is also regarded as wholesome because of very good learning environment, supportive and accommodating seniors. Now let's talk about urology department. There are a lot of house officers in this department, so it is less hectic. Environment is good, especially for female house officers as they get much relief. It is very supportive, enjoyable, and less hectic. You learn technical skills like stitching, dressing, passing Foley catheter, and doing suprapubic cystostomy. It is recommended for you if you are interested in urology or want to learn the management of common urology cases, or you have to prepare for some foreign exams. Next one is neurosurgery. It is a good rotation with a learning environment, but it is not considered the ideal rotation for exam preparation because it gets sometimes a bit hectic. Cardiac surgery is regarded as the least hectic ward with great seniors and most flexible schedules. One of the rare wards where you can easily study for your exams. Highly recommended for you if you want to prepare for some exams. Now comes the turn of gynae units. Gynae is overall hectic and burdensome, but worth it for females. There are 3 gynae units in Jinnah Hospital. Let's start with gynae unit 1. It has 30 house officers. It is enjoyable, with good learning. Overall experience of seniors was moderate. Clerical work is definitely a lot. And skills you learn about SPD and steps of C section. But some seniors claim that they got less opportunity to perform independent deliveries. Reason was the more number of newly inducted residents at that time. Recommended because of good roster, enjoyable environment, and post call is off. Gynae Unit 2 has very supportive and enjoyable environment but hectic as well. Good learning and clinical experience, and you get enough chances to perform SVD. Recommended because of good reviews about clinical learning, and also the post call is off. Next is Gynae Unit 3. It has 16 HOs, 2 private but no paid seats for outsiders. It is supportive but overall a bit more hectic. This unit is said to have a lot of work, a lot of skills learning, and a lot of clinical experience. You get a lot of opportunities to do independent deliveries, but post call is not off. And some seniors are said to have a little bit of toxic experience as well. But overall experience is moderate. I is a light surgical allied rotation, which is mostly recommended if you want to study for exams or you want to relax. There are two eye departments in Jinnah Hospital, and both units have comparable reviews regarding learning. Difference is I1 has more number of house officers, so less number of calls, but the post call is not off. While in I2, house officers are less, so more number of calls, but post call is also off. Overall, I1 was more recommended by house officers than I2. A reason may be more number of house officers or might be improved learning experience. Now let's discuss about the medical allied rotations of Jinnah Hospital. Let's start with dermatology. There are two derma units, Derma 1 and Derma 2. In Derma 1, there are total 15 house officers, 5 are government and rest of them private. Environment is very supportive and enjoyable and less hectic. Overall experience is moderate. Clerical work is less. In technical skills, you get to learn about intralesional steroids. There is good learning experience with helpful seniors. It is highly recommended if you have any exams or you want to pursue derma. OPD is very productive. Regarding derma 2, there is only OPD, no ward calls, so very light. You get enough time to prepare for exams. Regarding pulmonology, seniors had good learning experience but not so chill and relaxed ward as considered. No data could be found about the number of house officers. Next is radiology. Total number of house officers is 15 to 16, out of which 6 are government and rest of them are private. Environment is supportive and not much hectic. Overall experience is moderate. Clerical work is up to 80%. In technical skills, there is not much skills learning, but you learn to interpret X-rays and know the basics of ultrasound scan depending upon your interest. And you may learn to do fast scan and OBS ultrasound. Seniors will teach you when you ask them. No one will force you to learn. Recommended as OBS ultrasound is high yield. If you have interest in radiology and want to know about this field in detail, you can choose this rotation. Next, we discuss about nephrology. There are 12 house officers, out of which 8 are government and rest of them private. It is very supportive and enjoyable with less hectic schedule. Overall experience was moderate, least clerical work. In skills, you can learn to pass double lumen catheter and get to know about dialysis. You can learn about management of AKI, CKD, glomerulonephritis, rhabdomyolysis, hypertension, electrolyte imbalances, and titration of doses. It is also associated with two dialysis units. Seniors are very supportive, competent, and eager to teach you. You take rounds of all different wards to attend patients there and give them plan according to nephrology. It has amazing ward ethics and protocols. Choose if you want an easy rotation with good learning. No such negative reviews about nephrology. Now let's discuss about anesthesia rotation. There are 40 house officers, out of which 20 are private. According to my info, there are no paid seats for private HOs. Wonderful environment, fully enjoyable, and moderately hectic. Wholesome experience of most of the seniors. There is moderate clerical work. In skills, you get to learn about all the life saving skills and procedures, including maintaining IV line and CVP line, intubation, induction and maintenance of general anesthesia, spinal anesthesia, pediatric anesthesia, laryngeal mask airway, NG tube, ventilator setting, blocks, ICU care, doing CPR, and managing drug doses. And you get clinical experience of emergency care, pain management, and ICU care. Highly recommended because of its supportive environment, technical skills, and clinical learning. Anesthesia calls are a bit hectic. Remarks. So many. Now let's have a look at the pediatrics department. There are 30 house officers, 15 are government, and rest of them private. Overall experience of seniors was moderate to toxic. It is said to be very hectic rotation. There is a lot of clerical work. In technical skills, there is much learning of skills, but it also depends on your efforts. Regarding PEDS management, this unit is super rewarding. You get to know about PEDS OPD, gastroenteritis, pneumonia, epilepsy, anemia, measles, and all the common cases. Totally recommended if you have a good stamina and patience, and if you want to learn PEDS management or pursue this field in future. It also helps you in getting emoship. Points against the recommendation are one of the most hectic rotations of Jinnah Hospital, and also a bit strict environment. But there are some good seniors as well. Seniors reviews are it gives you confidence in dealing with babies. Take it at first or second rotation so you have enough energy to cope with it. In psychiatry, you get good experience in easy working environment with less duty hours. Oncology is chill rotation. It makes you manage the whole ward all by yourself. Seniors are nice, good learning, and less hectic rotation. Psychiatry and oncology are recommended for exam preparation. Before I end my video, I want to introduce a great opportunity to learn OPD case management for general practice. It's the seventh session of the course named Train the Doctors for General Practice by Dr. Moin Akhtar Kharal. He is a brilliant teacher. You will become expert in OPD case handling. Details of this course is provided in the description. You can get discount on the course price by registering through the link given in description. I hope the video was helpful. Please like, share and subscribe. Please like our Facebook page to get all updates of Jinnah Hospital house job. Link is given in description. Thank you.